Morning, everybody. Thanks very much for joining another Health Data Research UK Federated Analytics webinar. Today, I'm very excited because the talk will be brilliant. We have Blaise Thomson from Bitfount. He's going to talk about a new tool for defining federated workflow. And before we start his talk, just a few things to bear in mind. If you have any questions, they are going to be answered in the end, so you can put it in the Q&A box in Zoom, or you can add it to the chat. We'll be looking at them. The webinar will be recorded, so you can watch it afterwards if you want. And let's abide by the HDR UK values. And I hope you enjoyed the webinar. Before Blaise gives his talk, Jonah is just going to give some update on the Fed Day program. So off to you, Jonah. Thanks very much.
Thanks, Graziella. For those who might not know me, I've joined the team, the Federated Analytics program team, in the last 6 months or so, as the project and outreach senior manager. So if you hear my name or want to reach out, feel free to do so. So for those who might not know, the Federated Analytics program is focused on transforming our researchers securely access and analyze data across multiple locations. So here I've listed our objectives, and this program's a collaboration with University of Manchester, Swansea University, Dundee University, and Uni of Nottingham. And here we really work across this federated research spectrum where we think about discovery, analysis, and learning. It's not just analytics as much as our program name says. In terms of discovery, the team have developed various solutions that have been implemented, including Bunny, Carrot. I'll put these links in chat after, so you feel free to have a read of those. In terms of analytics, we've developed other solutions, and I can put links to those in chat as well. And in terms of getting involved in hearing, I guess, more detail, not just steal Blaise's thunder today, I'll put links to our mailing list. So this is where we normally send out our events and presentations and any links that we might be presenting at. Importantly, we've got our events, our webinars that occur every 2 months or so. We have Blaise today, and I'll be posting a link to our next event that's happening in 2 or 3 weeks, the 1st of October. And we also have regular monthly, drop-in sessions where we sort of present more of the detail around our technical plans and some of our solutions we're developing. So by joining the mailing list, you'll be included on those. And then we've got our GitHub. So we're trying to champion open source development and try to be transparent in how we develop our tools and our solutions. So we've got a GitHub up and running to either review backlogs or submit issues or post discussions. So that was a very quick update. And as I mentioned, I'll put some links into the chat if you'd like to reach out or talk further on what we're doing or what we're planning on doing. So without further ado, as Graziella mentioned, I'll hand over to Blaise to take the reins and show us through this new tool for defining federated workflows. Thanks, Blaise. And I'll stop sharing.
So just a quick introduction to Blaise. He's the CEO of Bitfount, which is the federated platform, and he works accelerating research, clinical trials, and AI model distribution. He was also previously the founder and CEO of Vocal IQ, which was sold for Apple, and he also worked as a research fellow at the University of Cambridge. So thank you very much for joining us, Blaise. Off to you.
Great. I'd be keen to know if there's a little black box. I know with Jonah's there was a little black box, but I'm hoping that it's not coming up for people. So
No, it's okay now. We can see the screen. Thank you, Blaise.
awesome. Okay, so I'm going to be talking a little bit about federated analytics, which is clearly the topic here. And I'm actually going to spend quite a lot on some of the problems, a lot of time just to try and kind of share our experience of trying to get federated analytics working. And then I'll present what we've already implemented and some of the early work we have on this new federated workflow tool, which I'll explain at the end. Um, so just to get everyone on the same page, hopefully everyone kind of already has this in their mind, but what do we mean by federated analytics? And what are we trying to solve? Well, there's always this challenging problem when we're trying to work with sensitive data, where it's often very challenging to transfer the data out of the institution and get a centralized data store for analysis, which would be the normal way that people do analytics or machine learning research. So normally or traditionally, you'd want to transfer all the data into a data lake or a data warehouse, and then it makes analysis very easy. But that doesn't really work when you've got sensitive data. And so the federation approach takes the analysis that you want to do and sends it to run locally in each institution that has data. So we might run it in small little clinics, in big hospitals, in trusted research environments, which is the focus of the FedA program, I think. Um, but either way, you're doing the analysis locally and sharing back the statistics. So that's probably something that everyone's aware, but important always to get us all on the same page. Um, and this does solve some really important problems. So I thought it'd be interesting to just share a few slides on what we've been doing and how it's actually helping in practice. So a big area we work on is in cohort discovery. And I know that's also something the FedA program is interested in. Um, what we've typically been doing is running AI models in ophthalmology clinics and analyzing all of the retinal images that the clinics take. And then that allows us to accelerate the clinical trial process. The typical recruitment in these trials is around 2 patients per year per clinic. So it's really a very laborious process. Um, and we've seen now that we're implemented in a few trials, we often identifying hundreds of patients in just a few hours. Um, Currently, we only analyze the images, but we're actually now in the process of also analyzing the electronic medical record in a federated way. And I say federated because the sponsor of the trial specifies all the analysis that needs to be done, and the clinics are all kind of waiting for that analysis, and it gets sent down to them, runs locally. Um, and the clinic gets actual patient level data, and the sponsor gets aggregated statistics of how many patients have been identified. And what's been quite exciting for us is we're actually finding patients and they're getting recruited now into the trials. Um, and another actually quite interesting aspect of this is we're seeing a reduction in what's called the screen failure rate. In a clinical trial, it's typical that the clinician proposes candidate patients, and then there's a separate group that has to kind of verify that they meet all the criteria for the trial. So a trial will, in its protocol, have a collection of inclusion and exclusion criteria. And typical in retina studies is about 52% screen failures. What we've been seeing in our patients is about 25%. So it's really significantly reducing costs for these trials. And also, we think in time we'll be accelerating the recruitment, although the numbers are quite small at the moment. So that's one great example of it in practice, but there are others as well. So something we're in the process of rolling out now is what's called real world evidence in the case of kind of pharma research. People are interested in reports of the data that's actually happening in clinical practice. And again, here I'm showing one in the ophthalmology case, which is where we work a lot. And we can run and gather data from all the different clinics, whether it's from the medical record or generated from AI biomarkers on the imaging. And then we can get insights that are useful for trials or for other purposes. Um, Another popular thing is what's called federated learning, so actually training an AI model. We did a project several years ago now with a Cambridge group called Cadre, and you could see that you could train. In their case, they were interested in logistic regression models, um, and you can do that across different TREs. And then finally, another use case which we found very interesting is just evaluating models in a federated way. And that's really cool because a big problem for developing these new AI diagnostics is that they tend to only get validated on a few hospitals' data sets, but actually you want to test them out in real clinical settings. And we have a project now with the International Retina Imaging Society where we're gathering statistics or gathering data sets from different clinics, and we're going to be validating AI models, a collection of AI models, and kind of working out which is working the best on a wide collection of data sets, all the time making sure that the model developer feels comfortable that their IP is not being released. So there really are lots of really important applications that come out of this federated approach, which get unlocked because the data doesn't have to be centralized. But I think there are some interesting challenges which we probably hadn't fully appreciated before we kind of got into this. So I want to talk about three key ones. And I guess they all kind of come around to this question about what the task is that's going to be run in a federated fashion. And the first kind of relatively big issue is a question of trust. How can the sites trust that the data is not going to be leaving in this federated world? How can they trust that it's not going to do some analysis that they didn't expect? And in the traditional TRE model, you have a very, very restricted kind of ingress and egress approach. So you have to have a lot of manual verification. But if you want to do a federated learning or more complicated federated analysis, it sort of becomes infeasible in the long term to have everything being manually checked. And so there's a question then of how do you enable these sites who have very sensitive data to trust the analyses that are going to be done on their data, to trust that the code that's going to execute doesn't have anything nefarious, and to kind of allow the egress that needs to happen. Then there's a question of data standardization. So oftentimes different clinics or different hospitals might have different data set schemas, even though they're referring to similar underlying data. And so if you want to do this federated analysis, you do need to find some way to do a standardization. And then there's a question of how do you do that appropriately in a federated world. And then a final thing I think has been a real challenge in these federated settings is the linking question. Now, this doesn't happen a lot when you've got different clinics looking at different patients, but in research, you often have situations where you have data about the same people, but it has to be stored separately. This is especially true of genomic data, where the holders of the genomic data have very specific requirements about what they can do in sharing that data. And it tends to not allow that data to be transferred out of their research environments. So there's this really big question. Okay, we're doing a federated analysis, but how do we do linking appropriately? And what does that mean for the analytics that we're going to do? So I just want to dive a little bit deeper into each of those problems because I think they're quite interesting. And they also kind of explain a little bit about the solutions that we're going to get to later. Okay, so there's this question of trust. There's a bit of a trade-off now. You want to allow relatively arbitrary code to be run, so a lot of flexibility, but actually arbitrary code is very, very dangerous. And the controllers of data sets, if they're sensitive data sets, are rightly very concerned about what's going to happen to the data, and they want to make sure that there's no risk of data egress that shouldn't be happening. So one component or approach that can be taken is to use containerization. So this is a technical solution, Docker being probably the best known of these, where you have a very restricted environment for running the analysis. And it's quite typical, I think, many of the solutions that are doing federation use Docker to protect what can be done by the analysis. So that does give some protection, but it's very hard to actually understand what's happening because Docker is how the entire internet is being run. I would say, or most of it is containerized, um, and it's extremely flexible. You can really run absolutely any code, and so you have to be as a kind of governance person. You don't really have a lot of insight if you're just using a containerized approach. So I think that can form part of the problem, part of the solution, but maybe not everything. Another part of the solution can be having a privacy layer. Um, so what I said is the traditional approach is essentially manual verification of anything that egresses. But there are a few technologies which try to do something automated around the egress of data. So a classic one is something like small number suppression, where you ensure that any data that's leaving the premises is always aggregated to a certain level. For example, you always have to have at least 5 patients in any aggregated statistic. So um, that's one approach you can take. There've been shown to be some concerns with that specific approach because if you are allowed to do 2 queries, you can very quickly get back to any individual data point. So, just imagining, as long as you can do relatively arbitrary queries, um, you could imagine doing things like, find all the patients up to yesterday, find all the patients up to today. Both of those numbers might be well over 5 or 10 even, but the difference might be exactly 1. And then you can start very quickly working out individual data sets. Or if you want to look for a specific postcode, you might say, find me all people and then all people not in this postcode. Both of those numbers are going to be above um, your number suppression level, but the difference actually gives you the number in the postcode. And because of that technical attack, uh, another approach has been developed called differential privacy, and that gives a much stronger statistical guarantee of data leaving. Um, but it's quite a complicated thing to understand for governance teams. And it's also relatively restricted in the analyses that can have it. And it doesn't solve the fact that you need to protect and be sure about what's running in your data set. And so that leaves us to the third component, which is having some kind of declarative task specification. Um, and that's essentially a lot of the idea I'm going to talk about here, which is enabling people to compose tasks from components that people actually understand. And doing that in combination with these other components, I think can give a really strong both understanding and level of trust and also technical guarantee about what's happening to the analysis. So that's the trust question. The second issue is data standardization. Um, and I think you see this a lot with electronic medical records. And I've just shown 2 example EMR systems, Epic being probably one that everyone knows, Nextech being a relatively niche one, but quite popular in private practice. They're very likely to have different formats for storing their data. And so they're going to have different ways of transforming that to get into a common format for the analysis. And so you kind of want to make sure when you're doing an aggregated, federated analysis that all this data can be transformed appropriately. Um, Actually, just referring back to something Jonah said earlier, the Carrot tool that's been developed in the FedA program, I think is an interesting approach to some of this, actually implementing some examples to convert data into OMOP format, which is one standardized approach. But of course, you do need different transformations for different data sets. So that's data standardization. And then linking, I think, is something that's actually not been talked about a lot. But when you start talking to data scientists about what they'd really like to do, linking really comes up quite a lot, interestingly. So um, I guess I'll start with not needing to link and just aggregating across sites. And I think this is actually relatively easy and quick to understand. So, let's say you want to calculate the sum of two numbers. You want to, and this can generalize to as many sites as you want. Um, what you can do is you actually just have A and B exchange a random number like X, and then A sends A plus X, B sends B minus X. You add the two together and you get A plus B. So this approach is a technology called secure aggregation, and it's an example of something called multi-party computation. And so it kind of generally allows the aggregation, the summation of different statistics in a relatively easy way, I would say. Now, that allows us to do lots of really interesting things. So, in the case of training across different patients or different data sets where there's not a lot of overlap, um, you get a lot of very quick, quite easy wins. You can kind of total up gradients, for example, if you're doing training of models. You can total up sums or summary statistics if you're doing a statistical analysis. Um, so it's definitely very helpful. But when you want to start linking across multiple sites who have the same patient, um, that that kind of analysis is not sufficient. Um, so let's just take this example. We've got two sites with a list of names, and we want to share the overlap of the data sets without sharing any information not in the overlap. Then the kind of classic first approach people take is to hash everything. So you go through all the names and you hash with some solution. And then you just compare all the hashes. And and that's actually a very efficient way of, for example, getting a count of the overlaps. So here we transfer everything. We'd see which ones are um, giving the same hash, and we quickly see, okay, there are three in the overlap. However, from a cryptography perspective, this is actually not a very good approach because something like a patient name or even an NHS number is generally restricted to only have something like a few billion options. And with a machine, that's actually not very hard to attack, to just run through all the different options. So that's called a dictionary attack. And it leads to the fact that this simple hashing approach is not sufficient to protect the data that's going to be transferred or be used to calculate these summary statistics. Um, so what do we do? Well, actually, common in hashing is you can use something called a salt. And the technical idea here is that along with the hash, you apply this extra uh, variation key, if you like. And that makes it impossible to do a dictionary attack because that key, the secret, could be absolutely anything and it would completely change everything. Um, but the problem is you can't share that key with the other party. And so what the solutions tend to do is they do two times the communication. So let's say we're trying to calculate the overlap between datasets in A and B. Then A will send over a hashed form with its salt applied, and B will send its hashed form with its salt applied. And then both sides apply their hash again to the other side's hashed code. And as long as you have an appropriate hashing function, um, specifically applying your salt needs to be commutative. You need to be able to switch the order. Um, you can end up with double salted hashed values where neither side is able to work out what the other side's salt was, and so they're unable to do a dictionary attack. Um, but they are able now, they will both have both sets of data double hashed. And so you can now calculate things like the overlap. So so there are solutions to calculate things like the overlap between data sets that need to be linked, but they're a bit more complicated. They require multiple rounds of communication. And when you start wanting to use them in practice, you end up kind of having to compose them quite a lot. So here's what I think might be a kind of interesting typical question that a data scientist might have. So they might think like, okay, what's the prevalence of this exon 19 deletion in lung cancer patients? Except that all the genetic data is in one site and all the clinical data is in a different site. So what we're looking for really is just the number of patients with the deletion and with lung cancer, and the number of patients without the deletion and with lung cancer. Um, so basically the way you end up doing this is you have to do two calculations. So you do two of these private set intersections. You've got the patients with the deletion and the patients without the deletion. You've got the patients with lung cancer on the other side, and you do two of these private set intersections. But as you start wanting to do more complicated analyses, this all kind of starts getting more and more complicated. There are also solutions that do training of AI models where the data is separated, but those typically kind of have to start with a private set intersection and then do the what's called vertical federated learning. So all of this kind of starts actually being composed of lots of little pieces in order to achieve the calculation of a statistic that's interesting for the data scientist. Okay, so how do we solve all of this? So what we've been doing actually for a while now in Bitfount is structuring a lot of the solution around essentially approved task types. And we have a declarative way of defining tasks. So we have 6 main tasks that we have built into our platform, and they do the main use cases that we've seen to be interesting. So on the AI model side, there are things around training the model, evaluating the model, just running the model. So that's on that side. And then on the more kind of traditional analytics-y stuff, there's running SQL queries and getting statistics. There's this private set intersection that I talked about. And then maybe slightly separate is actually transferring data after PII removal, which is another thing that kind of comes up for us. And then all of these different task types can have different parameters, but I guess the critical thing is that for someone on the governance side, they can look at the task type and they can understand what it's trying to do, and they can decide whether they think it's appropriate that the required communication happens. And then you can have projects that specify which task types are allowed and which settings have to be specified. So here's a screenshot of our platform where you have a specified project. As a data custodian, you'd get invited to join the project. You can decide what data you want to connect and what the legal terms and so on of the project are. And then when you actually go ahead and join, there's these legal terms that you kind of have to accept, and because of our general platform license agreement, there's a legal authority for that as well. And then on the connecting data side, the clinic or the hospital that's connecting their data, they get to choose the types of data they want to connect. They can filter it however they want, and then they can connect it up. And this is kind of part of the solution, I think, of making sure that the data schemas align. But this is a solution where the data custodian who's connecting their data is the one who's kind of making sure that it aligns with the schema that was required by the task. So our tasks have a kind of expected schema, and the data custodian has to connect up the right data to make sure that it's compatible with that schema. And then you can go ahead and run tasks. And so, going back to the patient pre-screening use case, you can calculate all the data locally, you can output it locally, and it's all kind of defined by this task template. And you can specify who's allowed to run the task. Is it only people who have the data, or can the project owner run the task. So there's kind of classic roles in this project. I suppose what's also quite interesting is you can also access control the models. So a project can request permission to use a model, and then if the model owner approves it, they can have it kind of approved for that project, and then they can control how many times it gets used and so on. Okay, so going back to our kind of list of problems, I think we're solving like a few of the key issues. So on the trust side, we have this restricted set of allowed tasks, uh, each of which I think is kind of relatively understood by the clinicians or by whoever's in charge of the governance. We have a method for data standardization, which currently is mostly providing a bunch of tools for the data custodians to transform their data into into the schema that was expected for the project's associated task. And we also have an approach to linking. So we support this private set intersection algorithm, for example. But then in actually calculating an interesting statistic, we kind of leave it a little bit up to the data scientist. They have to do this protocol a few times, and so the workflow might feel a little bit clunky. So that brings us to this new approach we've been trialing a little bit, and be lovely to hear people's ideas about it, and yeah, hear if anyone would like to kind of collaborate on it as well. So the idea basically comes to this thinking that, well, we're actually trying to build a federated workflow more than just a specific task. If you think of traditional data processing where data is all co-located, you have a lot of frameworks for building workflows. How do you kind of compose these subtasks, which all generate new data, which then gets kind of composed into other pieces? So it's quite typical in workflow language to talk about a task that, and we're going to use the same concept in this framework here which we've called FedFlow. And the task is going to run completely in one site. So for example, we might do the data transformation in that site. And the key thing is it takes inputs at that one location and it outputs data also at the same location. But unlike in a normal workflow tool, we're going to have another concept, which is a fed task. And these are cross-site task components, which include communication, which are taking inputs from multiple locations and also outputting outputs at every one of those locations. Now, I won't talk much about it now, but we also have a concept here of federated map, where you can do an iteration of a map over a data set and then do one of the fed tasks, essentially, also a federated workflow multiple times. Okay, and the tool we've developed allows people to define the workflows in Python code directly or through a YAML format. So let me show you in a little bit more detail. So, okay, so we've got our example that I talked about earlier of trying to do this analysis where we have to do some transformation, but different transformations in different sites. Now, again, traditionally, you'd kind of have to, well, what we've been doing until now is kind of leaving a lot of the data transformation up to the site themselves, which can work, but it isn't always possible. Mostly for cost reasons, I'd say, or even for information like knowledge reasons. Sometimes the data scientist wants to play around with different transformations. And in Fedflow, what you can now do is kind of define the whole thing as one workflow, where you've got the workflow that's related to sites that are using Epic, the workflow that's related to sites using Nextech, and then the workflow relating to the aggregator site as well. But we have tasks that are operating in one location, but we now have this kind of new kind of task which is operating across the locations. And if you've got something like secure aggregation, that protocol that I talked about earlier, where you're computing things, you're doing this communication, and then in the end, the aggregator is getting the total. it allows you to actually build out the workflow in one place, kind of looking at everything and seeing, okay, we in this place we kind of have to do these conversions, but then we've got this data that we want to use in conjunction with data in another location, and then that's going to result in an aggregation coming out in this third location in this particular case. And so I've just used a slightly different symbol to notate the fact that we have a federated task operating here. And then we can actually write this up in code. So I've done this semi-pseudocode, but this is actually pretty close to what we have in our implementation, where you define a function, but the parameters of that function are basically the sites that are going to operate or the roles that are taking part in the collaboration, and then you just refer to kind of data sets that are or data that's in each location by using kind of traditional this dot notation. So imagine we've got a function that runs locally. This would just normally be a normal Python function that's going to get out EMR data given an EMR link that's available in that site. And it's going to extract the gender and diagnosis. And that gives us imagine that gives us a pandas data frame. And then what we have is a sort of standard function again that maps values that operates on a data frame. And in this case, it's going to convert the gender field, all the M's to male, all the F's to female, and it's convert gender to sex. And now we have a new data frame. And then we summarize that data set. Again, imagine this is a Python function that's been defined here. And then on the other EMR side, let's say Nextech, we extract sex and diagnosis. And let's imagine that this is already in the form we wanted, so we don't need to do any transformation, but we still need to summarize it. And then we define this aggregator data output as a secure aggregation from those other two. And so here in quite a concise way, I think we've defined this quite complicated workflow actually, but also in a way that I believe is actually relatively easy for a site to understand what's happening. If they are comfortable that these are known functions, or we can kind of build out a few standard functions, then it's kind of easier to understand what's happening and allow approval of this function to run in their site. Okay, so let's move on to the linking example. So we had this issue. Okay, we want to specify two of these private set intersections, and I've just put these arrows here to kind of show that we want to eventually calculate this this number, but there's actually tons of communication happening here under the scenes to calculate that. And what we can now do with this Fedflow kind of concept or tool is we can kind of actually explain what's happening there. We're running a private set intersection federated task, and that's what calculates the overlap between these two data frames. And so again, you can kind of write out a very simple workflow, assuming some Python functions that would be built in here. So, find the patients with a specific gene deletion being true or false. And then on the clinical side, you're probably doing a database query, something like selecting all the patients who have this diagnosis. But then, and these would just be normal Python functions or, however that works in the site. But then you're doing this PSI count, which actually is one of these federated tasks, which calculates some number, for example, in this case. Okay, so what does that all do for us? What we now have is a approach I think that's maybe a little bit more flexible, basically. So we already had this framework where we have quite a restricted set of federated tasks, each of which is quite understood. But this new approach, I think, is quite interesting because it's potentially much more composable, much more flexible in what can be done with it. On the standardization side, we have these tools already to help people get data into the right format. but now we also have an extension where we can have data scientists specifying the transformations. And so that kind of allows us to switch who's doing the transformation. And maybe we have allowance for both, right? Sometimes the data custodian is better placed to do the data transformation, and sometimes the data scientist. Um, and then when we're doing linking, it's nice because the linking tasks or questions often require lots of these things to be composed. And so we can build that now into a workflow. Okay, so that's the end of my talk, and I'm hoping there's some questions to discuss. But I guess to summarize here, there's a lot of things already happening with federated data, and it's great that there's so much interest in the approach. In our case, we're doing a lot around patient cohort creation, accelerating trials, reducing failure rates. The site feasibilities are really interesting. And academic collaborations can also start leveraging data a lot more. Um, I guess what I was hoping to present here is that we have some existing tools which I think solve some of the key challenges we've seen. And we've been developing this new tool, um, which I think could be quite an interesting approach to having more complex workflows. So we haven't quite gotten to the point where it's stable for public release, but I'd love to kind of collaborate with anyone who'd like to play with it. So let me know, and I can send it over.
Thank you very
Thank you.
much, Blaise. We have a few questions, and I do have quite a few questions as well, and we have a bit of time. So
Great.
there are a couple of questions from Max. The first one is you were showing a case study where there were AI-generated biomarkers from the data set. Can you talk a little bit more about what is this AI-generated biomarker?
Yeah, so in that case, it's basically analysis of the image in that specific case. So here's an example. So what we have to do is it's a kind of like, so there's an OCT image taken of the patient, and this is a volumetric scan. I don't know how well you can see here, but oops, let me see if I can somehow zoom in for you. Um, there's a This is actually just one slice of a volumetric scan. And in this particular disease, um, these white areas are basically problematic because it means that one of the layers in your eye is is has died, and so you start getting these bleeding through. It's called hypertransmission. And so what we need is that the an AI model can kind of detect areas of concern. And in this particular case, this layer that dies is called the RPE, the retinal pigment epithelium. And so the model has to detect the fact that the area has died. And then from that, we have to go from this volumetric scan into an area of the en-face that has problems. Um, so that's what I'm calling an AI-generated biomarker. In the specific case, it's the thing that's of interest is the area of geographic atrophy in millimeters squared. Uh, but actually, there are several others that are interesting for these trials. So the other things that are interesting are things like the distance from the fovea, which is the center of the eye, to geographic atrophy. And the fovea itself has to be detected using an AI model because that's also from an image not always completely certain. So there are multiple AI models calculating these different areas as well as locations of different things. Um, and those are all meant to kind of mimic something that's known to be interesting from a biological perspective. Um, we've so kind of outside of this disease, you get other things like that in eye diseases. So often you'll want to calculate the volume of a fluid or the various other distances. And you of course get similar things in other diseases like the presence of lung nodules in lung cancer.
Okay. Thank you. I have a question around the work that you have done for clinical trials. Obviously, cohort discovery in clinical trials is very important, but there is a higher risk of disclosure control because sometimes you might find a very small number of patients in particular sites. Is there any additional protection that is used in this case, or is it traditional ways for disclosure control that you've mentioned?
Yeah, so uh, the disclosure controls, basically we only ever share with the sponsor the number. Well, actually we're exploring also sharing like patient IDs. Um, Currently we have like a restriction on the number of well, we only share the number of patients. Um, we we haven't yet had any concerns about low numbers, so like anything like low number suppression. Um, And we're now just exploring whether we would share patient IDs as well. Uh, not PII, like hashed patient IDs with Assault. Um, and I think in most of the sites we're working with, that's also kind of considered to be okay. So yeah, I guess I would say we haven't really had a lot of concern with that level of protection. I suppose what would be the issue that I guess your concern is if we only find one patient who matches the criteria for the trial. Um, but I think the only thing that would be disclosed is that that patient is in that one site. So I don't think anyone's really been concerned about that. In fact, that's the whole purpose of the analysis, right? Like I think both sides want to know whether they have patients for the trials.
Another question from me, and then I go back to the questions from the audience. You talked a little bit about the solutions that you've created for differential privacy, content containers. How would that interact with the current architectures and requirements present in SDEs and trusted research environments? Because they have their own rules around containers and what can be installed. So if you were to use Bitfount solution within TREs, is there anything that needs to be adapted?
No, I wouldn't say so. So we don't have to have the TRE. That's sorry, we don't have to have the container. Um, that's one option in our solution, but we also actually quite often will deploy without containers just because it's easier for many sites. Um, the key thing we normally find is a challenge with TREs is that we want to have an outgoing internet connection, a kind of a permanent one. And because TREs are kind of set up to have manual disclosure at every stage, they're often set up that there's just absolutely no outgoing internet connectivity from the TRE, and that that's sort of like a fundamental s- separation from it just completely prohibits what I would call a normal federated analysis. Um, anytime you want to do things like federated learning or the private set intersection, it's it's not really that feasible to have manual steps in between. But there are quite a lot of TREs who are kind of open to that as long as it's a very restricted set of tasks, which is, I think, kind of why you have to have this trust layer. And I think you have to have a way of defining declarative tasks because I don't think there's there's other working groups looking at disclosure control and whether you can automate things. And I think it's basically very hard unless you know what the code is that's going to run on your data and what the analysis is meant to do. Because if you just look at model weights, you don't really know what they mean unless you know how they were generated. And that's certainly the same for like anything like a hashed output. Like, you know, how can anyone manually know what that means unless you know how the hash was created? So I think this declarative task specification is how you counter the concern around having an internet connection. But that's the thing that I think has been challenging. But in terms of interacting with TREs, we've had like very good relationships both with and experience both with the Cambridge group who I mentioned and of course with Nottingham as part of the Terrifics program. Um, and in Terrifics, again, it's kind of the same design. You have to have an outgoing um, internet connection. Um,
Yes, there is another question around TREs, which is what is the digital footprint that the Bitfount solutions leave in TREs? And is there any IT sophistication that are necessary, which is the sort of conversations that you need to have with the TREs department to have it installed?
um, well, so in terms of like the code size, it's very small. Well, unless you want to if you want to do machine learning, then you have to install, machine learning packages like PyTorch, which are usually a few gigabytes. Um, So in terms of like size of footprint, I don't think it's significant. But then of course there's like the outputs and the logs that are generated during task runs. And yeah, so we of course generate all of those locally. But I would say the interactions with IT teams tend to revolve more around kind of general security practices than the digital footprint locally. So they tend to be Um, well, yeah, so there tend to be things around like, the fact that we have ISO 27001 certifications and all the management we do around that. That tends to be a big concern. Um, I don't know if it's so much with TREs, but what we do see quite a lot with hospitals and clinics is just like as soon as you talk about analyzing data, people think you want to move the data away. And so we often have a big education effort to explain our approach is federated and that the data doesn't have to leave. And once they understand that, it certainly simplifies the discussion a lot. But I think most people default to thinking that you want to take the data. So that's certainly something we have to explain a lot.
And is Bitfount solutions in compliance with the 5 Safe framework?
Yeah, absolutely. We have I've given a few talks about that in previous TRE areas, but absolutely. So you've got well, you can kind of run through them, right? So um, safe people. We've got our project management framework where you can define who's allowed to collaborate. Safe setting. That depends a bit on how you deploy it, but if you have something like the containerization, then you're quite content that the place where the code is running is very secure. Um, Safe. You just kind of run through safe projects. We have a whole project framework, and so on. Safe settings you can see because we have the task definition where you specify what the options are. So actually, I feel like it's a very strong mechanism for defining for achieving the 5 safes.
And now, 2 final questions. I'll try to bundle them. We have to wrap up the webinar, so whatever questions that have not been answered, we'll send it to Blaise and we'll put it in the HDR website. But there are quite a lot of interest in the data standardization and transformation that you have been used specifically vis-a-vis automations and bespoke labor, and how important it is to have this standardization for the community to adopt these tools more widely.
Yeah, I think the standardization is a big topic, right? It's just a lot of work. So how important is it well, it's very important. How important is it to standardize everything? I think, I guess I feel like there are two potential outcomes, I'm not really sure which way the world is going to go. But because I think there's quite a lot of potential benefit from large language models, and so I think one outcome could be that people use the large language models to accelerate the standardization of their data into something like OMOP. Um, and I know your teams have been quite involved in helping that. And then the other way that it could go is that people leave all the data unstandardized, and then they use things like large language models to make the querying um, much more generalizable and kind of not care about the fact that the data is not standardized. I think that latter approach is going to, it's sort of still, it's a lot more computationally intensive every time you have a query. And so I suspect you're probably going to always have both. It's probably my guess. Um, So yeah, building these tools I think is very valuable. I think it's a very important topic, and certainly a lot of the benefits we've had have been because we've been able to at least standardize the imaging components that we read, um, because well, images are a bit more standard anyway. Um, so yeah, very, very important, I'd say.
Okay, thanks very much, Blaise. It was a very interesting talk. If the audience has any further questions, keep adding them to the chat and we'll pass it on to Blaise. And thanks very much for joining us, and I'll see you in the next webinar.